In the beginning of the pandemic, people were saying wear a mask to protect other people. And then they were like, well, wear a mask to protect other people and maybe protect yourself too. And now we know it's both ways because if you have a mask that filters well, like a KN95 or N95, and there's not a lot of air coming out of different places because it's well fitting, the mask filters both ways. So it protects other people from you if you happen to have the virus and have no idea. It protects you from other people if you happen to be around someone who has it and it doesn't have symptoms, or if you happen to walk into a closed area like an elevator where someone was there 10 minutes ago breathing out all sorts of virus and you have no idea, you're protected from those viruses with the mask. I would say, to answer your question, which is how do we stay away from this variant, best thing is wear the best masks you possibly can. And then, wash your hands and all that stuff that they say, but it's the mask probably that makes the biggest difference, and staying away from crowds. I'd say that too.
Thank you so much, Arash, for coming. We really do appreciate the time you've taken to explain to us all of you got very specific with it and you didn't have to, and we really do appreciate how thorough you were with the answers. Just thank you again for your time. Is there anything else that you'd like to say before you go?
Well, I just say thank you for inviting me. It was a pleasure to be here. And also, you guys have been through a lot. Young people have been through a lot. Give yourselves a little bit of a break and recognize that it took a lot of strength and resilience on your part to make it through these last 2 years. And you're going to be okay. If you don't feel okay, ask for help. Ask adults that you trust for help, because we're right there with you. Adults want young people to do well. You're not the only ones going through. If you're having a hard time, you're not the only one experiencing that. Please don't feel either ashamed or embarrassed or whatever to ask for help. The healthiest adults in the world are the ones who are able to ask for help when they need it. So it's good practice to start now.
Thank you so much again. I'd love to have you back on in the future, but for now, we really do appreciate it.
Thanks
Thank you. Yeah.
All right. Take care, everyone.
Take care. So what are you guys' opinions on the little lesson we got?
I would definitely say it was really interesting to learn about how different youth have been reacting and how it's been spiking anxiety and wanting to have that sense of control because you're at home so much. I think that learning about that and how that's connected to substance abuse was really interesting because we don't really have that perspective, since most of the time we're usually thinking about how we feel and we don't get to understand how other youth may feel when they're going through really similar stuff.
He did a good job of talking to us, not at us. I listen to podcasts, and whenever they bring on an expert, the expert's very impersonal. I was like, okay, I wonder how he's going to be. And I was actually really interested. It sounded like I was listening to a podcast.
I agree with you, Elias. It felt like you were listening to a podcast, but it was also, he's right there. You can ask anything you feel. You can ask any follow-ups. You can talk to him about anything. And he was really thorough with his answers. I did appreciate when I put in the comments asking about the N95s, because a lot of people I know said, you're breathing out bad air. And then some people are saying the opposite. Really cool how he does the Stanford teen van and how he told us. It's like as if you're in an actual clinic. I mean, all the resources they have in such a compact area while being on the go, that seems so cool. And just the fact that you're able to cover so much distance. And it was really nice that they were able to help families who are struggling. These guys, their families aren't able to work. Also, some people have premeditated health concerns. They have had cancer in the past, or they have compromised immune systems. Even if they aren't sick, they get sick, especially in a time where there wasn't a vaccine, they're pretty much kaput. I mean, not only losing a family member, not only losing income, that also impacts you and the others around you. And it's a really stressful situation. As a whole is what stood out to me the most. But you said, Eli, it being impersonal from some perspectives where they're talking your ear off. He was actually talking about experiences that meant a lot to him and involving us as well. Anagha, is there anything else that stood out to you?
Yeah, definitely. I was also struck by what he said about eating disorders, because I definitely think that a lot of the things that cause people to become addicted to certain substances can also cause them to get things like eating disorders. And a lot of the things that trigger that, like stress and anxiety and wanting to have a sense of control, like what the pandemic inspired, can also inspire a lot of disorders and illnesses that you wouldn't have expected if we weren't in such a unique situation.
Yeah, it's really a realization aspect. You brought up the anxiety part. I thought that was also a good point that he brought up, which was especially with family, how the cultural norms that's the safest space. But is there anything else we should talk about? Is there anything else that you guys were interested or really wanting to talk about or discuss?
I think one last word about how Dr. Arash is a professional coming from a professional point of view, and we are teens in high school right now. And I think it's a really cool opportunity that we got to talk to a professional who can see the real effect of these things, that we and you, the listener, can bring your perspective and notice what's actually happening. And I think that's a really good opportunity. I think we should continue noticing these trends and continue noticing how these things unfold.
Well, I think that's where we conclude. I really do appreciate all of you guys for coming out. I'm very happy I was able to be a part of this conversation as well. Thank you again, Marcia, for the whole organization aspect of it. To the viewers and the individuals listening at home, thank you for listening. We do appreciate it from me, YAB Anagha, and Marcia, and the Stanford YAB. It's very much appreciated. So I hope everybody has a great day.
Thank you.
Thank you.
Thank you.